Welcome to Kranky Live, the show where bold minds meet real talk. This isn't your average sports or news show. It's where we break down sports, culture, and controversy with facts, fire, and fearless honesty. Here, truth cuts through the noise and hype gets exposed. From football to track and field, from world issues to local debates, we ask the tough questions, speak without fear, and go deeper than the headlines. We don't follow the crowd, we set the trend. While others recycle the same tired takes, we bring fresh insight, unfiltered analysis, and bold perspectives. No echo chambers, no puppet talk, just real conversation for people who think for themselves. Listen with your brain, not just your ears. Think critically, question boldly, and speak freely. This is Kranky Live, where reason rules the mic and truth always wins. Come on, let's get into it. Good night, good night, good night. Let me know if you can hear me out there in YouTube land. Good night, everyone. Just give me a drop of text in the chat and if you can hear me. I want to make sure I'm coming through loud and clear. And you know the drill. As you come in, just hit the like button. Somebody in the chat just dropped me. I know that One Love was here earlier. Just tell me if you can hear me loud and clear. So we have a good topic to discuss tonight. So I want to make sure everything come across real well. Nobody in the chat. I said we have like 8 people already so far. You can't just drop out. Are you not subscribed enough to be able to to comment in the comment section? Anyway, let me get started. I see that you can hear me. Tonight we have a really good subject to discuss. As you know, we're trying to be versatile on this channel. Even though I'm actually streaming on 3 different platforms. Well, 2 platforms basically. I am streaming on YouTube, obviously. I am also on Twitter, and I'm on both of my YouTube channels, Balanced Views, and also Michael Roberts. You can hear me clearly, right? Balanced Views, and obviously on Kranky Live. And tonight is a really good subject, everyone. So sit down, relax. Some of you may think this is an old people discussion, but it's not. Tonight, conversation is sort of overdue. I've mentioned before I want to do much more of these sort of subject. But it's overdue, but it's necessary. When we hear about various diseases in our communities, especially in our Black community, we sometimes don't get educated as to what they entail, how they derive, things of that nature. So we're going to talk about 2 things tonight. So Michael said you can hear us. Hypertension, which is also the more vanilla name is high blood pressure, and diabetes. And when many people think about these diseases, even though I'm not sure disease is the right term, because when you say disease, it sounds contagious versus something that you may just have. So like something that's distributed, and it's not. But diabetes and high blood pressure, people think it's just for old people. And that's something that happened, and it happens to other people. It doesn't happen to me. That's not necessarily the case. These diseases are what we call sort of silent killers. I know YouTube don't like that name, so I'm going to use silent, unlived diseases. They develop quietly, they progress slowly, and by the time you discover it, the damage is already done. They disproportionately affect Black people globally, across the Caribbean, across the United States, UK, Canada, and the wider diaspora. And one reason this problem persists is confusion, especially around diabetes. And we talk a lot about that tonight. Many people don't realize that diabetes is not one disease, but multiple conditions with various different causes and consequences. So tonight is not about fear. It's not about blame. It's more about clarity, I would say, and consequences. But before we get into the numbers and talk about these, one, note of transparency. The most detailed public data available, I'm going to say from the United States. So I'll probably reference Black America in this discussion, but it's Black people in general. I'm going to use Black American as a proxy for the Black community. And Black American, as you know, includes people from the Caribbean, Africa, and all over. Africa, I should say, all over. And while exact percentages vary by country and over time, the direction of risk is clear and consistent across the Black community globally. I think one can draw that inference and that reference. So I am not a doctor, as you know, even though I may pretend like I want to be one. I'm not a doctor. When we talk about these subjects, I want people who are real expert, experienced in the field, to have the conversation. So I brought my doctor in tonight, people. I brought my doctor in tonight. Dr. Dan, good night. How you doing?
Good night. Can you hear me?
I can hear you.
Okay.
Audience, can you hear Dr. Dan? Let me make sure I turn you up. Speak again. If I can hear you.
1, 2, mic check, mic check, mic check.
Yeah,
One,
mic
two,
check
one,
work.
two.
Mic check. Mic check work.
DJ.
So I'm driving with Dr. Dan. And you guys know Dr. Dan, right? He's in the chat a lot. He's a highly regarded board certified, I can say board certified now, right?
Yeah,
board certified cardiologist.
That's my exam.
Exactly. So board certified cardiologist and internal
Medicine, internal
medicine physician. And he has many years of experience. Went to Howard School of Medicine at Tampa General.
See the shirt?
Yeah, no, I see you trying to. As if a big school. But anyway, but Howard is one of the probably more renowned universities in the States, and especially in the Black community. And a lot of Jamaicans, because a lot of Jamaicans frequent this channel, actually go to Howard. And as Dr. Dan told me in a previous discussion we've had, when he went to medical school, there were a number of Jamaicans that were at Howard. So Dr. John, welcome.
Yes, welcome.
And by the way, he's a Manchester United fan. We won't hold it against him, especially now they're doing well. And he likes to try.
3 out of 3.
Okay. 3. So let's jump into the discussion, because from your experience as a cardiologist, how serious are hypertension and diabetes within the Black community compared to, say, other groups, for example?
So let's get a quick definition before I go, right?
No, we're going to the definition.
Okay. So,
we're going to the definition.
So you often...
We're do the background first, and we go definition. So go on.
Okay. So you often see diabetes and hypertension is often higher in the Black community, mainly because we have our diet is a huge reasons why you often see that as well. We also have other situations like socioeconomic issues that also plays a role in when you see a lot of diabetes and hypertension for us. Socioeconomic meaning that education is not widely known in our population. So obviously, if you're not really educated, you don't understand what's to do. That's going to be influential. Example is like let's take for instance our Jamaican diet, right? When we cook, we put like oil, we put a lot of different things in it that will increase your risk for what we call,
We're not reached it yet. We're not reached it yet. We're gonna go through all of that tonight, as you know.
Yeah.
I just want to know the conditions that. So you know what? Let's back up. Let's define it first, and then we can set the stage where we define it to go through it. So let's define diabetes. Let's define hypertension / high blood pressure, and then we can go to the details you're doing.
Okay. So let's look at, so normal blood pressure is what we call 120/70. So if you put your hand on your heart and you feel your heart go doo-doof, doo-doof, the top number is the first beat. The second number is the second beat is the second number. So for one to be considered what we call, we go through different stages. We have elevated blood pressure, right? Where it's like 120 to 129. That's elevated. And then we call stage 1 hypertension is 130 to 139. And after that, anything that's greater than 140 is considered hypertension stage 2. There are different treatments for all of those diseases levels, but I guess we will get into that later on. We'll get into that.
I have a question for you then. So when I go to the doctor and they put their hand on my wrist here and hold it, what are they trying to determine?
It's your pulse. They feel your pulse is AKA your heartbeat.
Because mine is always low. Is that bad or good?
No, it's not necessarily bad. It becomes bad if you're falling out. Like people have low. There's some people who can survive with low blood pressure, right? And some people could survive with low heart rate. It only becomes an issue if you keep when you get up in the morning, you get dizzy, you fall out, and all that stuff. We call that orthostatic hypotension. So generally, what we do is obviously we give you that medications can be done with that. Fluids can help with that, right? But it's not necessarily a bad thing. You just don't want it to be too low. If it's like say 80 or 70 systolic, that's really bad. That's really bad.
So, do you see these conditions appearing earlier in blacks versus other groups, for example, or
Yeah, I
just
do. Okay, so yes, so in black people, I do see at least what I do blood pressure wise does appear early in blood pressure, and I read something where it says research shows about 5 to 8 years earlier in blacks than it is in white, and the reason why that's the case is because they cause something called is genetic factors that can cause that. Then you have access to proper health care. Those can be actually an issue as well. Access to proper health care. And then you have like structural differences. So like cultural norms, policies that's against us. So those are kind of some issues I've seen in my practices. Like I give you an example. I had a lady who pretty young girl, I think she was like in her 30s, who came in and was like, I didn't know that I should check my blood pressure or my blood pressure will be this. And obviously she's younger, she's 30 something years old. You have an iPhone, right? iPhone is everybody can just kind of do some research and kind of figure out why, give you a number. But you do see that in us because, again, genetic wise, we tend to have that genetics. Yeah.
is that the health section of the iPhone, the health component? You can go check something like that.
Yeah, the health section of the iPhone actually it picks up your heart rhythm, right? So like people who have what we call AFib, which is irregular heart rate, so that health section of your iPhone and or your Apple Watch can actually picks up if you have like irregular heart rhythm. Yeah.
Okay. And I know blacks in general, whether economical or otherwise, and especially black men, sometimes push off when they see something occurring that may be irregular, going to the doctor. So do people tend to come later than ideal when they have these conditions?
Yes. So again, a lot of people because hypertension we're talking about hypertension, right? You can have what we call ACE, you don't have any symptoms, but it does not stop the disease from progressing, right? So all it does, your disease is still progressing in the background. It's just that it doesn't stop. So for instance, I had a patient who hasn't been to the doctor for years, and then he came in and I checked his blood pressure. It was like 160 over, I think it was like 160 over like 70 or something like that. So I asked him, I said, have you, been to the doctor before? No, he says he's healthy. Yeah, he works out, he does all these things, but it still doesn't matter. If he can progress, he still won't have the symptoms. What's dangerous about that is you can progress and then you end up having a stroke because, the blood pressure, you have that on, you just sit there, blood pressure is high, and then you just get up one day and just fall over your couch, you get stroked out. So it doesn't necessarily mean that you don't have any symptoms. It doesn't necessarily mean that you're healthy or not.
Well, I mean, when I look at some of the research I was doing for this show and some of the studies, roughly half or more of blacks live with high blood pressure versus a Caucasian population, which is probably in the 40 percentile. And hypertension, as you're mentioning, the lady you saw normally begins in the 30s or 40s, sometimes even earlier. So do these studies that I just mentioned, does it align with what you see clinically, including Caribbean patients?
So I'm going to be quite frank. Where I am, I don't see a lot of, I'm in Central Florida, so I don't see a lot of black folks. But, and I mean, honestly, I'm going to be black.
Is it that they don't live in Central Florida, they don't go to the doctor? Which one is it?
It's a bit of both. I think us as, I think we have this stigma towards we don't trust doctors, we don't want medications. I find that plenty of times when a patient come in to see me, he or she's always doing a lot of Google doctor, right? They don't trust doctor, they see this on a doctor, they see that on a doctor. So a lot of them doesn't actually show up. So when they do show up, it's far gone. So that's one reason that you can see that. But like I mentioned, in my practice, I do see, because I'm in Central Florida. Central Florida has a high population of what we call retired folks, and then we call them snowbirds that comes down this time of the year when it's cold. So, a lot of them, they're already in their age. So obviously the coronary's thick and everything like that. So they have the hypertension. But when I do see the few blacks, yes, I would agree that a lot of them just when they came in, it's just too late because it's like They just haven't seen a doctor in years.
So why does hypertension starts earlier than say other diseases, for example?
So for us as Black people, why it actually start earlier. So here's an example. You have, as I mentioned, you have the genetic factors. Like I think there's a gene called the APO1 gene. You guys can look it up. It's APLO1 gene, and it's often seen in Africans and Black American people. It's actually it's a risk factor. It increases the risk for hypertension. So that's one thing, that gene. And then you have our socioeconomic factors, like I mentioned before, like education, right? Often we don't have the education. So people with dropouts or high school education, you tend to see that a lot. And then you also have income factor, right? Income is a factor. Like you can't afford, you can't go to the doctor, you can't get regular checkups. That's also something. And then you have BMI. Your BMI actually increases your risk not just for hypertension, but also for type 2 diabetes, right? So those are things that you also can see that affect the earlier in us African Americans or Blacks.
So if hypertension is so silent, how dangerous is living with uncontrolled blood pressure for years without symptoms? How dangerous is that?
Okay, so living with hypertension for years without symptoms increase the risk for what we call cardiovascular diseases. Cardiovascular disease can cause what we call coronary artery disease, where somebody will call MI. MI in the cardiovascular world is what we call heart attack, right? That's because what happened is after all those years, your hypertension destroy your coronaries. It also will cause what we call heart failure. So then what happened is you end up become so bad when you get there, we put you on 4 or 5 medications because it progresses no matter what. If you don't have any symptoms, it doesn't change at all. You know what I mean? It's just like I said, just like how let's look at an example, right? If we look at something called pancreatic cancer, right? Pancreatic cancer, most people come to see you when they have pancreatic cancer when it's too far gone, stage 4, because they have no symptoms. So most people come to you when they become jaundice. That means they're yellow, their eyes is yellow. It's just too late. That's similar to that, where it just progresses over time to where it's like, okay, you're now stuck on medications for life.
So here's one thing that comes to mind as you were speaking about that, because of the silent nature of hypertension or pancreatic cancer. Do you think AI can be I'm going to go there, right? Do you think AI can be something which can be, I want to call it predictive, but probably can help in earlier detection at some point in time? Because are there things, if one look hindsight wise as a doctor, where, you know what, if we had thought about this, maybe we didn't notice this earlier? Because I always believe that there's a symptom, but we don't recognize what the symptom is.
Well, I mean, AI is a human developed tool, right? So it's me, you, or another doctor who's developing AI, who's putting in the information, right? So if AI probably can give you a reminder, in my opinion, probably say remind you to I don't think AI can pick up and say, hey, you have cancer per se. You can put in your symptoms, and they can say they recommend that. So that's as far as I would say.
So people write this down that Kranky is going to predict that AI will be able to identify pancreatic cancer much earlier than now. And the reason I said for this is this, individually and as countries, you may do things. AI is going to take all the information across the globe and collate it in a system, right? Which is what human beings can't do. We can't know every single thing that happens everywhere, but AI can do it. And I think at some point, because I always believe that every disease has symptom. You just don't know what the symptom is for some of these diseases that are silent. But I digress a little bit. But I'm just saying I do think that will happen one of these days. And especially when we have AGI, which is it can now think on its own versus us telling it what's supposed to be. That should be able to happen. Go ahead, Dr. Dan.
But you also got to remember there's some symptoms that's and some disease that overlaps, right? So there's some disease that connects as well. So one thing is not one. So that's why AI can recommend, okay, this is likely that, this is this, so just having just one, and that's how it is in medicine. There's no one straight cut forward thing that you said, okay, 100% sure that this is it. That's not always the case.
What you're saying that AI can only do what human beings, because we populate the AI and it's just pulling from us, but at some point I would think it may be able to garner information that not necessarily come from human beings per se, just based on what it has and how it projects out. But anyway, let's go to diabetes.
Yeah.
when we look at diabetes, the stats that I read says 13 to 14% of Black adults have diagnosed diabetes, depending on whatever study you look at. Compare with single digit, for example, for Caucasians. And we always do the Caucasian Black comparison, not necessarily Asians per se.
Yeah.
And complications are significantly higher for Blacks. So why are outcomes worse even when diabetes is diagnosed? And how much of this come from delayed detection?
All right. So few things is the reason why I think, and I came to medicine because I wanted to, as you know, my story is well documented. I was a investment banker and all that stuff. I decided to come to medicine, and I came to medicine because one, I wanted to advocate for my patient, and another thing is I like to do research because research advances your knowledge, your expertise in a certain topic. It also advances medicine in general. So I often do read about a lot of these things, and obviously I'm not an endocrinologist, but I read a lot of these things. But it's significantly worse than us because of the risk of complication also increase in Black people as well. Mortality increase. I saw where they said 38% of Black, for example, will get retinopathy over whites, which is 24%. Retinopathy, as you know, is just like when you have diabetes, uncontrolled diabetes, you get retinopathy, your eyes just become blind. And few of the reasons are, one is biological. There is research that shows that our liver, Black people liver, decreases insulin clearance because your insulin clears in your liver, right? So that's why whenever alcoholics or people have liver disease, why you see they have big titties, it's because the insulin, and along with the insulin, as long as there's the estrogen, they can't clear it because the liver, it can't clear. So you see them have big breasts because of that kind of reason. People have alcohol.
So maybe we should touch upon the different type of diabetes that there are and how those originate.
Yeah. So let me just kind of piggyback and just tell you all the reason why it's so worse. So one is the liver factor, right? If your liver cannot clear insulin, right? If your liver decrease insulin clearance, that's also an issue. You have racism. You have structural racism that we faced way back in the day, like the Jim Crow law, segregation. Those all plays a factor. You also have the social determinant factor, like I've always said, which plays a role in everything we do. And then you have healthcare factors. Again, let's be honest, us as Black folks, we don't necessarily like the doctor, right? So if we don't show up, those kind of play the roles why it's so worsened. So it can also be a treatment delay can play a role too. But let's not get it twisted that we can go to the doctor and still get our A1C checked. But A1C.
So wait, before we go further, because these are terms we may not get, including yours truly. So when we talk about A1C, what we're talking about. First of all, what's diabetes? Because I know there's type 1, type 2, there's pre-diabetic. So what are each of these? And then we can talk about what, for example, an A1C.
Okay. So there are several different types of diabetes, Kranky. But the ones that we come to know is type 1, which is autoimmune. And that's generally what we call like as a kid. You generally get that as a child, but that's actually not true anymore. Older folks are now being diagnosed with type 1. So let's keep that in mind. That's number one.
Wait. So type 1 is normally inherited, right? But you're saying...
Correct. Autoimmune, inherited, yes.
But if you see it later, does that mean you always had it, but you didn't know and it didn't manifest itself?
Yes, because when you get older, type 1 doesn't manifest as it would in a child. So like in type 1 as a child, you get what we call ketoacidosis, right? And it basically means pretty much you have a lot of ketones in your urine. So like when a patient come in the hospital, how I know they have type 1 diabetes, there's certain stuff that we do. One with the urine. The urine will show ketones. It also will show glucose. So but if you're late onset, like an adult, like 30, 40 years old, you generally don't see that ketone. So a lot of them get misdiagnosed for type 2 instead of type 1. But if they do the whole genetic workup, they still have the autoimmune. You see what I'm saying? You understand?
Okay.
So then you have type 2. The American Diabetes Association said 95% of diabetics is actually type 2. And that's I would say that's earned, mainly meaning like that's generally from fat people, right? And I hate to say this, but 33% of Americans are overweight, right? And let me give you the definition of overweight. So BMI, from 25 to 20, if your BMI is 25 to 29, you're considered overweight. If you're 29 and above, you're considered obese. So let's look at it this way. So 33% of Americans are overweight, and then 42% is obese.
So doctor, I'm gonna stop you. I'm gonna stop you for a second. Because I look at my BMI the other day. I'm not gonna tell you what it is, but it me not slim. So I'm told by some of the opposite sex I need to put on weight, and then my BMI is telling me something different. So what am I missing? What am I missing?
So okay, all right. Technically, me, Kranky, I'm very built, right? I weigh 200 pounds, right? I go to gym every day. I'm technically considered obese. BMI, there's been arguments that saying BMI wasn't made for the black man, right? Because we're very muscular.
I don't think so.
Exactly. Imagine. But what they do now, though, Kranky, they look at your waistline. They look at your abdominal waistline.
Okay.
Yeah.
Okay.
They no longer, so the BMI, they still do it in clinical factor because insurance want that. But what they do now is more off your waistline, right? So imagine if you're a football player, linebacker, go get their BMI. They're gonna say they're overweight because they're very muscular. So that's something that you have to look at. So BMI.
All right, so we're talking about type 2 diabetes.
Yeah.
And it disproportionately affecting blacks.
Mm-hmm.
And is it biological or is it lifestyle that causes this?
So type 1 is biological. Type 2 is lifestyle. And the most common cause of type 2 diabetes is obesity. All right. And so those are two. As I mentioned, we have late onset of diabetes. Late onset. It's called late onset. So like late onset of autoimmune. That's usually like somebody that's in their 30s. That's in their 30s, and that also often get misdiagnosed again for type 2, right? And then you have type 3 diabetes, which type 3.
I have never heard of type 3 diabetes.
I'll explain to you. Type 3C diabetes is from people with pancreas, like pancreatitis. So number one cause of pancreatitis is gallstone or alcohol. So some people who drink or have gallstone, they can possibly get type C diabetes. You guys can look it up in the chat. That's the most common. So like people with chronic pancreatitis, all that stuff can cause it. You also have gestational diabetes, obviously as a pregnant mom that get it. You have neonatal diabetes, and you have most people who doesn't have diabetes fall into pre-diabetic category. Obviously, there's more, but those are the most common one we see is type 1 and type 2. Most people fall in those categories.
So we've talked about the diseases, type 1, type 2, type 3. Isn't there something called pre-diabetics also?
Yes. Okay. So pre-diabetic is essentially reversible in a sense that pre-diabetic is basically you have high glucose level, but you have not reached the threshold to be considered diabetic. Again, your A1C is a hemoglobin A1C, which is a accumulation of your sugar over a 3-month period. That's why whenever we do screening, we let patients take the A1C every 3 months. It's an accumulation of 3 months. So in pre-diabetes, to be pre-diabetic, your A1C have to be from 5.7 to 6.4. After 6.4 or 6.4 above, we consider type 2 diabetes. Understand?
So you can actually, we talk about preventative or how you can reduce this actually. Yeah. So you're saying, you know what we hadn't talked about? We should back up a little bit. And maybe we'll get there, which is I have type 2 diabetes. What does that mean to my body? And what does it do to my body?
Okay. So type 2 diabetes is what we call insulin resistant. So let me give you guys a definition of insulin resistance. It just in human terms,
give us the 5-year-old definition because I'm not as sophisticated when it comes to this. So I want like a 5-year-old definition of this.
It just means your body does not react to insulin. Okay, let me give you guys a breakdown.
Why is insulin important?
Okay, I'm gonna say. So let's say I just eat a big pot of curry chicken, right? So I get a big pot of curry chicken. My blood is full of sugar. So in your pancreas, you have 2 cells. You call alpha and beta cells. Each one make insulin and one make glucose. So glucose, right? So I just eat a pot of curry chicken. My blood is sweet like sugar, right? So insulin comes now and take that sugar and put it in your cell as reserve, right? Because listen, insulin is an anabolic, it's anabolic, right? Also, you need sugar. Glucose is sugar. Glucose breaks down into carbohydrate. Carbohydrate breaks down into fat. Those are your stored energy, right? So what happened is now insulin comes and pick it up and put it in your cell. The problem lies now when you don't have insulin. So what happened is that sugar stays around your body and damages cells. So now people with type 2 diabetes, they have resistance to that insulin. So essentially, they have that sugar floating around, just hanging around, chilling.
So the insulin help you to store it appropriately, I assume.
Yes.
And then you can leverage that energy. Okay, interesting. Yes. Interesting. So let's talk about the damage then one gets from not having the right amount of insulin, or we say damage you get from having diabetes, for example, or hypertension.
Okay. So if you guys can see my hand, right? So diabetes, side effects of that, it called neuropathy. Remember neuropathy like this. People often say pins and needles, feel like something sticking them, sticking them, right?
I've had the pins and needles before.
Exactly that, because the sugar damages your nerves, right? That's one. Two, we call retinopathy, your eyes. The sugar damages your eyes. You can't see, right? The third one, the sugar damages your kidney, right? And remember, your kidney and your liver is a filter system in the body. If those two goes, you have a problem, right? Yeah, so those are things. It also can cause something we call gastroparesis. Gastroparesis is when the nerves in your stomach, you can't digest food. So you vomit and you throw up everything because the sugar damages your nerve in your stomach, right? And it also can cause poor wound healing. So that means if you get cut, me and you, Kranky, who doesn't have it, we get healed in 2 seconds. They'll take 6 years to get healed. So they get something called osteomyelitis, which is infection of the bone. And that's why you see a lot of people with sugar have to cut off their foot because of that. You get no proper wound healing.
So how does this normally occur to go make a decision to cut off someone's foot, as you say? How we get there? Given where we have to come from, how do we get there?
So we get there, one, what we call uncontrolled diabetes. You're not, again, this is what I said, Kranky. Okay, let me back up a little bit, right? A lot of people don't know they have diabetes so symptoms of diabetes is what we call polydipsia, polyuria, meaning that you're drinking water like you're thirsty, you're drinking, because hypoglycemia make you dehydrated, you're drinking, right? And then you're peeing, because you're drinking so much, obviously you're peeing a lot, right? So some people may think they have bladder issue when in general it's not that, right? And then when you eat, your sugar is so high. Because normal glucose, Kranky, is 70 to 100, right? So if you're over that, generally speaking, if you don't have diabetes, you eat, your glucose is going to be high. But somebody who doesn't have diabetes, your glucose doesn't usually go past 120. But somebody so we look at 126 after that is what we kind of say, okay, you have diabetes, right? So what happened is it gets to that point where somebody just don't yield to that, right? Listen, it doesn't creep up on you. It shows you sign that you have it, right? And it gets to the point where now you get your foot cut off, because what happens is you keep having these, osteomyelitis, it's an infection. If you don't cut that off, you get what we call sepsis. Sepsis is a disease, is an infection that will kill you. I've had so many of those people come in there. As a matter of fact, I had a patient yesterday who had his foot cut off because he had a big gash in the middle of his foot, like wound healing it's like he worm and everything in there, because what happened is his foot he has poorly controlled that. In fact, his A1C was 13, right? And
so wait, if it was it type 2 that he had?
He had type 2.
So if your A1C is 13, that means he didn't do anything to change the situation, right? Because you can change your diet and work out to help mitigate some of that, can't you?
Yeah, we'll get to that.
We'll get into that. But I'm just saying it's just really interesting. Okay.
Yeah. So that's what I'm saying. It's like you can, but the reason why we often cut off people asking my life is because there's no nerves there. You can't feel anything. But it will kill you, because infection would actually kill you. It's called, again, in the chat, you can look it up, sepsis. It will kill you, right? That's actually one of those infections that can literally kill you instantly. So what we do, because there's nothing there, we have to cut off that foot to cut off the infection from growing any further.
Yikes! I can't even think about that. Now, I've had a couple of friends who have had kidney transplant. Right? They've had diabetes, and it resulted in them kidney getting destroyed. How does diabetes and high blood pressure damage the kidneys?
Okay, all right. So in the kidney, you have something called glomerular filtration, right? So your kidney is like a GFR, it's a filtration rate. So when you have like that increased blood pressure, like it causes like inflammation, it causes stress on your kidney. So your kidney, the infiltration rate, like it increases. So what happens is it gets so bad to where actually your proteins spill out in the urine. So that's why we give medication called like lisinopril, which is like ACE inhibitor. It decreases the pressure on the glomerular itself. So it slows down. It slows down the minute. So that's kind of what happens. It's like from stress, sheer stress. Because remember, blood pressure causes vasoconstriction, Kranky. Let me use a quick analogy for you guys. I know with me, everybody's a pipe when you wash your car, right? If you squeeze the pipe, what happened to water flow? Water flow forward is going to be decreased. Everything's going to back up, right? So blood pressure causes constriction. So nothing going to flow out there, right? So that's kind of how it is. And so then what happens is it causes like sheer stress on the body, especially the kidney itself, and it damages it. Yeah. So then, so that's why we give certain medication that will, decreases filtration and protect your glomeruli.
Now, a couple of my friends who had kidney transplant, they were on dialysis, for example. What does that mean for someone daily life? Because it's almost like it's hell. First of all, it's very expensive, and second of all, it's very disrupting for your life.
Yeah. So dialysis is pretty much is your kidney. So So in kidney, you again, your GFR is your filtration rate, like I mentioned. You usually don't go to dialysis until your GFR is like 15, right? Less than 15. So basically what happened is, again, your kidney not working at all. And remember I told you your kidney flushes out everything. Drugs, some drugs go by your kidney, everything. So if you lose that kidney, certain medication, like say first, you can't even take morphine. Morphine is a painkiller. If you have kidney issue, you can't give you morphine because morphine is filtered by the kidney. What happened? You know what I mean? So what happened? You get to the point you get honestly, dialysis is tiring. It's usually for 4 hours, and you basically put a machine and it just filter your blood. It just filters your blood. Take out the bad one. It just filters your blood and then clean it out, and then that's kind of what it is. And usually you have to do at least 3 days a week.
So the dialysis is like a human. It's like a kidney, automated a machine kidney then. Is it like a machine? Because if it's doing the filtering, what the kidney is supposed to be doing, it's representing the kidney, isn't it?
Yeah, kind of, yeah.
That's interesting. Are Black patients overrepresented when it relates to dialysis?
In my practice, no. I've seen Spanish, I've seen Black, I've seen white. I've not seen just us. No, I've not. I've seen a mixture.
So this is very scary, frankly, to be thinking about your kidney not working and being on dialysis and doing it 3 days a week with someone's flushing out your blood. So what early tests could have caught this sooner?
To dial, yeah, and like I said,
before we get to the dialysis stage, what could we have done, especially with type 2 diabetes, to catch this much earlier and make changes to remedy this? What could have caught this earlier?
So there, like I said, there are genetic diseases that you just like, for instance, polycystic kidney disease. That's a disease where most people end up in end-stage disease by 30, 40 years old, where they end up needing kidney transplant or dialysis. That's one, right? But again, type 2, like I mentioned, where the ADA said about 90 to 95% of people is type 2, mostly caused from most of it is actually caused from obesity. Yeah. So
go ahead.
No, go ahead.
So we've talked about nerve damage.
Yeah.
We've talked about kidney failure.
Yeah.
I know we also have vision loss, right? When it comes to diabetes.
Yeah.
So how does vision loss occur when it comes to diabetes? How does vision loss occur?
So it's same mechanism. The sugar, again, all of these things are caused by the sugar from diabetes. It just pours into your cells and it damages your cells. And then when it damages cell, you essentially just it just goes downhill from there. And it's irreversible as well.
Okay. And then I know that Jamaican men don't have diabetes, gave one home to stay, but sexual dysfunction does occur because of diabetes. Yes. So how does diabetes and hypertension affect sexual function?
Okay, so
or erectile dysfunction is more like it.
So how does diabetes affect that? It's kind of, again, all of these things goes from the endocrine system, metabolic system, like I said, right? Again, if you're, say for your most people with diabetes type 2 are larger, right? And as I mentioned, because you're larger, your body holds on to more estrogen. The male should not have as much estrogen. So if you have more estrogen, what's going to happen to you? You know, your thing is not going to end up working. So that's kind of where that picture kind of.
What do you mean by your thing? You mean your sexual organ is not going to work?
Yeah, you know you're
not that about your thing, people.
Yeah, you're sure. Yeah, you know, it's cranky. It's the same component that happens when you drink a lot as well, because the alcohol is kind of the same component that happened. That's why Rasta people always say they drink up the spirulina, all that stuff. It's actually true, because what happens is, in order for your sexual organs to work, including, you know, men that has sexual dysfunction, we need vasodilation for our sexual organ to work, right? So if you have these, you know, constriction, what happens is it's not going to work. So you got those guys where that's healthier, or drink up the spirulina and all that, the mixes and stuff like that. That actually does work. I think for me, when I'm in clinic, I always tell my patients, I don't ever want to put you on any antibiotics, or I don't want to put you on any medication. The first thing that I always say is diet, exercise. Now, let me back up a little bit to hypertension.
No, we're going to get the prevention. We're going to get the prevention.
Oh, we're going to get there? Okay.
Sorry. Yeah, we're going to get the prevention. Because it makes sense to tell people how things are bad and don't tell them how they can fix it. So we'll get to the prevention.
Yeah.
So in terms of cardiovascular disease, I know you're a cardiologist, how do these diseases lead to stroke and heart failure? I had a friend, as I mentioned the other day, who passed away having heart disease. So how does it lead to that?
Oh, yeah. I think that's the one that we did. We talked about that, right?
Yeah.
Okay. So first, let me talk about diabetes first. How it usually will cause. So diabetes causes something we call atherosclerosis, and in a simple human form, it's like plaque. Cranky. Okay. I like to use analogies. So if we wash our dishes enough in our sink, without it being clean, stuff grows up. We got to get a plumber to clean out the sink. Atherosclerosis is plaque. That's why people, when they have diabetes, we give them something called statin, right? Because statin decreases what we call, statin is one of those things that help with atherosclerosis. So what happens is, then you end up with these atherosclerosis, then you get what we call smooth muscle inflammation, then that increases your risk for stroke. Literally stroke, I can sit here right now and fall out, I get a stroke. That's how dangerous stroke is. Like, you can drive, you can be walking down the street and you stroke out. You know what I mean? So that's kind of where it is. How insulin does it, on the other hand, is insulin causes what we call a left heart hypertrophy. So let me give you an example. Blood comes into the right side of the heart, and then, it filters in the lungs and go out to the left. So if your left side of your heart not working, it's the same analogy that I use with a pump, with a water hose. If you squeeze that water hose, nothing is going forward. You need your blood to go to the rest of the body. So because that water hose is constricted, there's nothing going forward, aka your blood, so you end up getting heart failure. That's kind of how it works.
Okay. So let's jump into prevention, which myself included, I'm sure the audience too, want to make sure, what can we do to not get into these very difficult situations or life-threatening situations?
Yeah.
What age should Black adults realistically start screening for these diseases?
Well, it depends. And I always said that because you have a lot of these things comes from family history, right? So usually, by, I think they say by like late 20s, early 30s, usually when you start screening, you should always screen for somebody for blood pressure when they come into clinic. It doesn't matter. If I see a patient who's 21, 22, I always take their blood pressure when they come into clinic. I always counsel them diet and exercise, smoke and drinking. I always do that. So you should always counsel somebody every time they come in clinic, right? So that's something that I would say, because the earlier you catch these things, it's curable, it's easier to treat. Because like I mentioned to you earlier, if you have elevated blood pressure, you have stage 1, stage 2, they're all a different treatment, right? Stage 1 is literally diet, exercise, come back and see you in 3 months, right? And then if after 3 months it's not working, then I give you a medication and say, okay, try that. So screening you regularly is one of those things. So there's no particular, so that I never use a particular, age. Some providers, do, some don't. But like, evidence-based medicine just shows like you do it every time.
So if I think about screening, we talk about, you said blood pressure, A1C, right? Which is what, hemoglobin,
Hemoglobin A1C, yes.
right? And I think the last time I went, I won't tell people what my number is. It wasn't a pretty number. So my diet changed and my workout. I'm in the gym every day. Fasting glucose, I guess.
Yes.
Kidney, blood, and urine tests.
Yes.
And if you're gonna damage your eye, I guess you have to get eye exam.
Yes. So okay, so let's this is how you do it. So your A1C you do every 3 months. Now, if your A1C is good, we push it out to every 6 months. If it's good, we push it out to every year. So people with diabetes, every year we do what we call an eye exam. Every year, a diabetic should get an eye exam, and then they should also get a foot exam every
What
year.
about somebody who's not diabetic, but they have risk of diabetes, right? Because we all have risk of diabetes. We don't eat right, we overweight, whatever it is. So wouldn't that also be more preventive? You'll notice it, maybe even catch it earlier before it gets to a certain stage?
Okay, so this is where regular follow-up to your provider helps. And then, like you said, A1C, usually it also depends on insurance policy, but usually for me, if I do a lab on a patient and I notice that he has consecutive or like his blood pressure is like high, right? Or when I look at his BUN, his creatinine is high. Or when I look at his glucose is high. Then I go and I get further testing. So I said, okay, if he's obese, I said, okay, you know what? I want to get what we call lipid panel, which is what we call high cholesterol, normal world, to see, okay, all those factors that goes into it. Then what I also would do is I'll get an A1C as well. And if his A1C come back in pre-diabetic range, I said, okay, I need you to change your diet and exercise. So again, all these things leads back to what we call regular follow-up with your provider, where we do labs. So usually how I schedule my patients to come in is like, if they're pretty healthy, I push them out to 6 months. I push them out to 1 year. If they're very sick, I say every 3 weeks or every 5 weeks, because I want to have a closer follow-up with them to make sure everything is okay.
Now, one thing I realized is that when I went to my A1C one, it was like over 6, and then I changed my diet. It went down. But then it is, if you grew up on a West Indian diet and the food here is good, you want to have that good tasting food, but at the same time, it's not the healthiest food. So how does one manage those situations where, to me, the healthy food, like the salad, whatever it is, unless you put some dressing on it, don't taste good. but it's not healthy. If I eat, in Jamaica, you grew up on patty and bun and cheese and all these things, which are, you drink soda, which is really bad for you, sugar-driven products. How does one change a diet and it's not necessarily disruptive to your life, at the same time trying to address the concern about getting type 2 diabetes?
So what I normally do is the CDC has diet and ways to go about.
Wait, the one under Trump or the one under Biden? Which CDC you're talking about?
Well, I guess the prior regime, because the prior. Usually, the CDC will have diet of, stuff that you should do, if you have a certain disease. Like, for instance, if you have diabetes, it's mango too sweet, watermelon too sweet, all these things is too sweet. So you have to curate your diet. Everything that you love, you can't eat. Essentially, you have to curate your diet.
So I'm a grape lover, I'm a mango lover, I'm an apple lover, but they're all sweet. Does that mean I have to cut those out of my diet or eat them in moderation?
I would say moderation. Even, do you know this? Even red meat, even steak in the steak muscle is full of sugar.
Right. Yes. I don't eat meat, so I'm out of that. I'm just giving you an
example.
But I understand what you're saying. Yeah. It doesn't seem like it has sugar in it, but that's interesting one, since it's an animal.
They actually recommend the best meat to eat for a diabetic, honestly, is, believe it or not, and it also helps with atherosclerosis in the heart, is salmon and chicken. Yeah.
So when you say eat salmon, is it fried salmon? Is it grilled salmon? Is it steamed salmon? What salmon?
Obviously, I tend to eat grilled, but the thing is that people make is that it's something like smoking. People say, "Oh, I'm smoking hookah and not cigarette." It doesn't matter. It's still damaging your lungs. People tend to figure out this. Yes, you're eating salmon, but if you fry the salmon, you're taking away everything. It's the oil that becomes the issue that messes up.
So if I use olive oil, is that still bad?
Olive oil is pretty healthy. Most people eat. Yeah.
Because I must admit, if you give me grilled salmon, I'm gonna fry it in olive oil.
Yeah, I don't eat fried food at all. or
No,
I try to eat less as much. In fact, I only eat one meal a day as well. And I try to eat. I do salmon. I do air fry. I mostly do my salmon air fry. Yeah.
I probably should. I have an air fryer, so I probably should think about doing more of that actually. But I do eat I must eat salmon almost every day, frankly.
Yeah.
Because I don't eat meat and I don't eat a lot of different kind of seafood. But salmon I do a lot.
Again,
Interesting.
don't think that your life is over. People who have diabetes, you can. You just have to be moderate in moderation. You have to eat little. So, and again, the treatment is, there's different kinds. If you're type 1, type 2. So, for instance, type 1, you have your basal insulin, you know what I mean, and you have your bolus insulin. Your bolus insulin, usually what we call sliding scale. You take your blood sugar before you eat, and and you have your basal, and you have your basal, which is an insulin that you take lasts 24 hours, right? So say, for instance, if you take your blood sugar before you eat, normally with type 1 diabetes, if it's a certain number, you give yourself a certain amount of units of insulin. The reason why I do that is to protect yourself because you're going to eat anyways. So imagine if you're going to eat, you're going to have your glucose going to be high because your insulin is not working in general. So that's kind of like what it is. So, we kind of tell them not to. And some people cheat their diet. Remember, type 2 diabetes is metformin. That's the number one. That's the drugs that you normally use. But there's other things people use, Ozempic and all these things. But the number one, the first line treatment for type 2 diabetes is actually diet and exercise before you get to metformin.
So let's talk about exercise because that's an important component of the preventative measure, or when it's detected, trying to, especially type 2, reduce your A1C. When you say exercise, how long, how much do I have to lift weights? Do I run? Do I walk? What do I do to increase my metabolism and to probably bring down my weight? What do I what's the level of exercise I need to do realistically to get to a good place?
So we recommend 150 hours a week, right? You can split it however you want, right? So 150 hours a week, 3 days of 50 minutes, however you want to split it, right? It's also heart healthy as well. But the thing is if you exercise, it drops your blood pressure by 11 millimeter mercury. So if my blood pressure is 130 and I exercise, it goes down to 129.
What's the duration of time? What's the duration of time you're talking about?
It varies, but I think they say within like a month actually.
Okay.
Consistent workout. Yeah. So that goes to show you how important diet and exercise is. A combination of those works. It depends. Some people have bad knees, so they don't run on a bike. Some people walk. You just want intense workout as well because it helps your heart, and also helps you with weight. But however, I think people mistake this. It's simple math, It's what goes in comes out. So if you eat less, you're fine, right? In a sense that the more calorie you put in the body, the more the body holds on to the less. Now, some people will say, when you're hungry, the first thing goes is your amino acid, which is a building block for your muscle cell. That is true. But if you don't put nothing in it, then it's not going to be, you have to worry about weight. Like me, if I see my pants getting a little bit too tight, I don't eat for 2-3 days. Just drink water and a snack, and I lose all the weight back.
Okay, because one thing I've been doing of late is trying to work out at a minimum, say 40-45 minutes a day. But I have my knees are shot from playing soccer for years and having multiple knee surgeries. So is lifting weights enough? Doing machine exercise and lifting weights, is that enough?
That's part of it, but you also want to get your heart up, running, get your heart up and flowing.
What if you can't run? Because I can't run.
So then, like for instance, my mom, she has bad knees, so I always tell her to walk around the block. Like, think about it. If you listen to 3-4 songs, each song's like 3 minutes. So if you walk around the block, that's 3 minutes per song, right? You listen to 3 songs. That's quick 15 minutes right there you burn. Or you can go on elliptical. Those things will help you go on a bicycle. Those can, also help. The goal is to get your heart running and just to burn off the much calorie. However, it doesn't matter how much you work out. If you eat whatever you want, it's not going to make a difference.
Yeah, I doing COVID, I bought a Bowflex machine, and it's really, really good actually. It takes the pressure off the knees actually. It's an elliptical machine. It actually works really, really well. But I wouldn't recommend walking in New York this time of the year. It's not the best. If you're in Tampa, if you're in Tampa, maybe not in New York. It's too cold.
To Florida. It was like 82 degrees today. It was sunny. I was driving my window down. Moved to Florida.
We're not moving to Florida. We love New York. We're a New Yorker. But no,
Yeah,
I mean, I walk. I walk during the spring and the winter. I walk like 3 miles a day, because I prefer to walk and listen to music versus being on the elliptical machine just in the same space.
yeah.
So, anything you have to say to the audience, doctor, before you go? I mean, I really appreciate you coming
is
on.
it brisk? Is it brisk walking versus just like regular walking?
No, it's brisk. I try to do under 50 minutes per mile. That's the goal.
Okay.
Right. You
So,
prefer to do
so
about 10 minutes per mile, but it all depends on the scenery around me.
yeah, it's there's other activities you can do though. You can well, in your case, you can't play tennis, but maybe swimming can do a little bit something. Swimming burns a lot of calories.
Yeah, the goal is to burn about 500 calories a day. That's the goal at a minimum. Minimum in terms of exercising, not just your normal moving around. It's burn 500 from either working out or including elliptical machine or walking. That's my primary goal. Because the goal is this, which is don't so if I take in 2,000 calories a day and my number is 2,000, for example, don't exceed that number. So between what I eat and when I exercise and the quality of what I eat should allow me to be below that 2,000. Because I normally, if I see I'm putting on too much weight, as you mentioned, in a whole week, I'll just work to burn 3-4 pounds off, some way, shape, or form, between diet and exercise.
Yeah. Before we ended, Kranky, first, I just, I want to say thanks for having me. I have a couple of my colleagues who I went to medical school with. Is on the chat. Helen and Kaya. They are two of my best friend. When I was struggling studying, I wanted to quit. They supported me, and here they are again supporting my. I'm sure they're gonna critique me, but here they are supporting me. By the way, they're both pediatric doctors, so very highly esteeming themselves as well. And I also have my coworker Jonathan, who's also online as well. He's listening as well. But these are all people who, when they say your community and people who, stand by you, they were always there catching me before I fall off the ledge. So I really appreciate them coming to support me. But I think before I end, I want to say this. And again, most of you guys who know me knows that I came to medicine because I wanted to make a difference in my community. I wanted to work with strictly, underprivileged people, including my Black folks. Am I seeing that currently? I'm not. However, I will say though, there's a lot of mistrust with physicians in this day and age. I can't tell how many times I have a patient come in to see me with already questions from Dr. Google and or AI. And obviously you need to know what you're saying and you need to build that trust with people. There's an alarming number of people who's getting diagnosed with diseases now at a younger age. One such thing is colonoscopy. So, colonoscopy before they used to do it at 40 to 50. Now they're screening at 40 because people are actually getting diagnosed at an early age because people are not listening. A lot of diseases, guys, it's asymptomatic. It means that you're not going to see it until it's too late. And when it's too late, then you're saying the doctor this, the doctor that. No, you have to have regular follow-up. See a physician who you trust. I try to treat my patients as my cousins, my family, my brother, my sister, my dad, because I know I want to give them 100% of what I have. If it was up to me, I tell people this all the time, I'll give free labor, but unfortunately, I don't own the hospital. I can't really do that. So just try to have regular follow-up, guys. You know what I mean? Trust your physician. If you think you have any questions, yes, you can look it up. Even my stuff, I do it now. Any of the symptoms I have, I look it up. But at the same time, you just have to trust these people and, get your screening. If you're at 40 years old, there's so many screening you need to get. If you're 30 years old screening, I need to start doing some more screening myself, because, again, I have family history of chronic diseases. And if you have family history of chronic diseases, there's a high chance you do actually have that as well. So that's why we're screening for that at an earlier age.
You know what's interesting? I talk about this with you sometimes, which is I have my doctor in my hand nowadays. That's my 3 AIs that I subscribe to. I have my doctor's in my hand. So before I go to the doctor, I'm checking out everything. When the doctor gives me information, I'm looking it up. And I would say most often than not, they're aligned. The AI information is aligned with the doctor. Sometimes it's not, and then I would challenge the doctor because I would like, why aren't you doing this test or why are you doing that test? Or Why do I have to come see you 4 different times? You're trying to generate income? Because every time I come to your office, you're charging me. So why could I had this conversation the other day with my doctor. I walked out the office because I was like, I don't have to come 3 times to do the 3 tests. You can do them all at once.
Listen,
And so this is not causing aspersion on doctors, but it's just me with my AI nowadays in my hand to say, you can do these things.
No, I would not disagree with you. There are some doctors who very smart, but there's terrible bedside manners. They just want to make as much insurance, collect as much more so than if you look at private practice. You see that a lot in private practice, right? Not everybody, but there's some people who are terrible. Because truth is, though, you don't get paid as much as you work as a doctor. People always think that we do. There's an emotional side of physician people don't see. You know, sometimes I see people.
That's why I don't understand when you left finance, but that's just me. Because finance probably pay as much as doctors. Yeah, in some respects, depends on what way of finance you are.
Yeah, you cannot pay an emotional side of medicine, right? You can't at all.
That is true.
The amount of hours you put, you miss family time, you miss holidays. That's why there's a high divorce rate. You know, there's a lot of things that you miss in medicine. Medicine is you got to be altruistic. Literally, you just have to be like, hey, I'm putting myself second here, my well-being. And the moment you do anything bad, you're going to jail, you're getting sued, you're losing your license. That's how it is, right? And it's 15 years of long studying, and you put away instant gratification. But it does feel good whenever a patient tell you, doc, you make me feel so good. I feel much better. That to me, I'll have a bad day, but one patient say, I appreciate you. You make me feel so good. It makes me feel like, man, I'm doing this because of that. There's no money, you know, there's not a, you know, you get paid well. Honestly, you do. You survive, but it's just, you know, you got to do that. It's all about that. So I implore you guys to just kind of like, you know, see a doctor. In this day and age, a lot of people are getting diagnosed with chronic diseases that can be prevented. And please, whatever you do, please stop smoking. Stop smoking. Smoking is actually work. You know, maybe 1 or 2 cups of wine, sure, but smoking is bad for you. Hookah, weed, no matter what people keep telling you, it's the smoke, not the weed itself. Because cancer patients get weed. It's the smoke that damages your lung. And lung disease.
But doc, isn't there a misconception that weed doesn't damage your body? It actually helps you.
Kranky, it's not.
Is it a misconception or is it fact? Which one?
It's not the weed itself. It's the smoke. That's what people misconception that people get. You know? Do you know we give people weed? It's called weed for cancer patients. They get that. It's the smoke that damages your lungs.
Okay.
Even the hookah and all that stuff, people think, oh, it's the smoke that damages your lungs. Yes. So it's just the smoke itself. So smoking is bad for you. People drink, you know, here and there, whatever. All that stuff causes lung disease and heart disease and lung cancer. Lung cancer is a no-go. It's one of those cancer you don't want. It's the number one killing lung cancer is lung cancer.
All right, Doc. Any last word, Doc? One last word before you go?
That's it. I'm good. Any questions, you know, I could take it. If not,
I don't see any questions in the chat. I see comments. I was looking. I didn't see any questions actually. Some of the people are agreeing with some of the comments that you've made, but I don't see any question in the chat. If you guys have any question before the doc goes, because we're gonna close the program down.
Yeah. Oh, what's up, Owen? I just saw Owen is chatting. Yeah, what's up, Owen? Yeah.
I don't see any questions in the chat.
You know, Kranky, this is not, you know, sports. People don't, you know, if we're talking about
Jeff. No, they'll watch it. Somebody will watch it later. People, if it's Jamaica football, they all turn up if it's for their own health. Here's what's interesting, people. You'd never want to say someone to say, I told you so, or you just say you have regrets. And when you hear the discussion about these subjects, and some people just say, oh, it's the old people stuff. And as Dr. Don mentioned, they're finding much more earlier cases of things like colon cancer, for example. So, you know, your physiology may have changed, or times may have changed, what you eat changed. Who knows what affects our body in a lot of instances and cause some of these diseases to occur normally much earlier than they have historically. So one should listen to these things, because sometimes it's not the most sexy topic. No. Take the information in, assess your situation, and make sure you put preventive measures in place versus detective. Preventative means you eat right, you exercise, and you do things that are right, and you don't smoke, because as the doc says, smoking is bad for you. you're moderate in your drinking, live your life what I would call the right way, and you'll have right outcomes. You live
Yeah.
it poorly, you'll have bad outcomes.
Kranky, I had this lady, quick story. I had this lady, she came in, right? She had COPD badly. She had to, this is how bad her COPD is. She cannot walk around with oxygen. She walk around with oxygen on her nose.
Now, explain what COPD is. Explain what COPD is.
Oh, okay. Sorry, guys. COPD is chronic obstructive lung disease. Essentially means that you cannot get any gas exchange in your lungs. Mostly like, basically what happens is you get rid of CO2, which is carbon dioxide, and you exchange that for oxygen. So COPD means you cannot get oxygen in and you cannot get the carbon dioxide out. So essentially your lungs cannot, open properly to get any gas exchange. So this lady had she has COPD on 6 liters of oxygen, right? And this lady's still smoking 2 packs of cigarettes a day. So I asked the lady, I said, Miss, you come in all the time. I give you treatment. You feel much better. You go back. So I said, when are you gonna quit smoking? I didn't know. I don't know. I'm like, what? Like that's what I'm saying. The education here, you would think it's a little bit better here, but it's actually not as good as I expected. Like the medical education is actually not, what I expect here in, a place like Florida, but again, I'm in Central.
Or is it that people just have other interests? They don't just want to deal with the pleasure that they get from things. They don't think about the repercussions, right? Because if you're smoking and smoking is good to you and you're addicted, you may know it's bad for you, but until it manifests itself into something, you probably just keep doing it. Until it get to a point where, it cannot be remedied, you probably keep doing it.
Yeah.
Like driving fast over the speed limit all the time and realize that, it's dangerous for you, still do it.
I mean, I'm notorious to speed limits, so I can't even complain about that. Well, you know what?
I mean, I'm not talking about 10 miles over the speed limit. I'm saying what Shakira Richardson did the other day, driving 100 miles an hour.
I mean, I don't go that fast. I'm in Florida. I don't go that fast. Although I have gotten away with some tickets because they saw my name badge. Like, okay, I was like, I've gotten away with a few tickets. They saw my name badge.
I got to put up my doctor badge to make sure. There's certain privileges afforded doctors, people. They save lives.
I will agree. There is. I've gotten plenty of upgrades, flight upgrades from that. So, in return, if something happened in the airline, I help. So I'll be praying nothing happened.
And you know what's funny? When I first started going to school, when I finished high school, I said I was going to try to be a doctor, right? And then I realized 15 years? No way, Jose. I'm not spending 50 years of my life in school. But I'm sure the ultimate benefits one derive catches up over time, right? You may spend 4, 5, 6 years in college, but then 15 years seems like a long time. But I think eventually maybe it's worth it.
Yeah, it's again, like I mentioned, it's ultimate like instant gratification because I'm telling you, it's some long days, and as I mentioned earlier about my friends who I'm not sure if they're still on, but there were times I wanted to quit. I used to text them like, I'm done. Like, you know what I mean? Like, they were like, yo, stop it. Cause you're going to feel so much better when you accomplish what you want. And it turns out to be, that's true, cause it's like you're at think about this day. A doctor's the only one to come in the room and say, take your clothes off, drop your clothes. You don't get sued. Or, you know what I mean? If you do that anywhere in life, you get sued for harassment.
Right. Okay.
You know what I mean?
And we see a question here. What natural stuff can you take for high blood pressure? Natural stuff.
Beets. Beets is good. Beets cause very great It's beets is something. I drink beets as well. It's cause vasodilation. It's an acquired taste though. It tastes like dirt, but it's good for you. Decrease your blood pressure. So that's something that one can take. Beets. You can eat it raw. I usually just drink it in juice. That's something that I get at Walmart or any of the organic places. So that's something that I can think about. Yeah.
Okay. My question is, I had a question about glycemic index. Can you answer a few words about it?
Yeah. So I think we touched on this earlier. The glycemic index is what we call the A1C and stuff like that. So it just depends. Usually, like I mentioned, prediabetes is from 5.7 to 6.4. And as I mentioned, prediabetes is where your glucose is high, but it's not high enough. It doesn't reach the threshold to be considered diabetes. So with that, obviously, diet and exercise. However, now When you're over 6.5, we start, along with other things clinically, we start saying that you have diabetes. So then what we do, we check your A1C every 3 months. If at 3 months it's good, then we push it out to 6 months, and we push it out to 1 year. That's kind of how it is. And again, diet and exercise is good. Unless we have to put you on metformin, we don't want to, because metformin has its side effects, which most people don't want to deal with. So kind of like that stuff. So again, preventative things, the high carbs, the bread that a lot of us Caribbean people like, the rice that a lot of us Caribbean people like, the dumpling that we like, the banana that we like, the yam. Those are all carbs. So if you used to eat 3-4 dumpling, cut it back to maybe 1 or 2. You know what I mean? And then get some exercise in. Like, those big belly that we have, it's not good looking, just, cut it down, cut it back a little bit. Just the beer and all that stuff. Those are kind of, things that will help.
Because I see men sometimes, they don't look overweight, but their belly's out here. You see the belly when they come around the corner first, and you're just like, how do your belly get so big and your body's just normalized? The first thing come around the corner, you see the belly, and you're just like, how do you get there?
I guess it's just eating. I guess it's just eating.
People say it's eating and drinking. I'm like, I just don't understand where everything just settled in that one place. The rest of the body look fine, and the belly is just out of sight. Here's another question, Doc. It says, what's more addictive, food or drugs? That's interesting.
Honestly, I'm gonna say drugs. I'm gonna say drugs, obviously, because like something like an opioid, right? You give people a lot of that stuff, they get stuck on the opioids, they can't come off. So I'll say drugs. Food is just that if you can't afford it, food is just food. You can cut it out, so I'll say drugs, because drugs actually hangs on to certain receptors and stuff. Yeah.
So this one says, Doctor, an answer for a family member. Why do they give you jaundice?
Jardiance. It's called Jardiance.
Jardiance, Entresto, and metoprolol for heart failure.
So all those things are for people cranky with heart failure, right? So metoprolol is a beta blocker. Basically, it decreases your blood pressure. Jardiance is a medication that's actually approved for blood pressure and also heart failure, and also used for diabetes type 2. The reason why they give you that, because Jardiance causes what we call mortality benefits, meaning that if you're on Jardiance, it decreases your mortality, meaning that you won't die early. Basically what it means. It's just one of those combination medications is why they give it to you, because it has mortality benefits, meaning that if you're on it, you have less risk of dying versus if you're not on it. That's basically what it means.
This one, I think we may have answered it. What natural stuff can you take for high blood pressure?
I think we have talked about that, but it was
about beets, right?
Beets. I think his name started with a C. He was saying that he was asking about the glycemic control in terms of foods. Honestly, I'm not.
Oh, okay.
I'm not 100% sure what food has what glycemic. To be honest with you, I do know that
you can get information that tells you the glycemic index for different type of food.
Yes.
Right. So the higher it is, then the harder it is for your body to process it. So things like strawberries are good, but grapes may not be good, for example. And the ones that are over a certain threshold, I thought the threshold is, because I was reading up on this. And I read up on it because I'm sort of pre-diabetic. I go back and forth between pre-diabetic and normal. The one with high glycemic index are ones you don't want to eat, or you want to eat it in moderation, actually.
Yeah.
So the carbohydrates and the sugar are in that category, yeah.
I don't particularly know which ones they are cranky, to be honest with you. I'll be lying if I say I do. I don't know which one they are, to be honest. That's something I'd have to do some research on and look at. I don't know which ones have more higher versus not.
Yeah, it's normally what I've read is normally the more sugary ones which have higher. So if you have
all
the Jamaican food,
like mangoes and all that stuff.
Bread, patty, cocoa bread, bulla, anything Jamaican you eat in high school, you destroy your body. When you're in high school, and poor people like myself in high school, and we eat all that nice, tasty stuff, it's all bad for you.
What's crazy? I can't believe when I look back on the food that I used to eat when I was younger, and I was like, geez, God really saved me, because man, I used to drink every time I eat, I had to get a sugar and water, a cup of.
But you see, then when I was that young, you were always out, always doing, at least when I was growing up anyway, always exercising, right? So you're burning off a lot of that sugar.
Yeah.
But our diet was atrocious.
Yeah. I think I saw a question.
Somebody said there's a table. I agree with this. There's a table. Yeah.
Yeah, there's a side effect of metformin. So side effect of metformin, you get GI issues. Like the reason why people lose weight on metformin because you get a lot of nausea, vomiting, diarrhea. So in essence, people end up losing weight taking metformin because you get GI stuff. Because nausea, you also get B12 deficiency, which is like vitamin B12 deficiency. You get that, and some other stuff like lactic acidosis and all that stuff, like which is like lactic acid inflammation. But a lot of people actually, side of GI is a very big thing in metformin. So people end up like everything you put in comes right back out. So they end up losing weight, which is like some people like it, some people don't like it. So it's like a form of, it's like Ozempic before Ozempic.
Yeah. No, I mean, look, it's always interesting thinking about these diseases, how they occur, the risk associated with them, what you can do to mitigate them or prevent them, what you can do for detection, and how you can probably reverse some of this. And some of them, as you mentioned, the whole blindness and some of these things are not reversible. We want to make sure you don't get to that stage or get to that point. And in our community, and I can tell you this, I've said this before, where I live in New York, for example, a lot of different places, most of the physicians I see are of a different persuasion. They're the Asians or Caucasians, they're not Black. I probably can count on one hand number of Black physicians. And I search for them, I deliberately search for them because I want to go to, there are a couple I know who are Haitians, but most of them are not, at least in the community that I reside in, they're not. And it's really interesting to see that actually. And because, as you mentioned, what's required to get there does take a lot, actually. What's required to ultimately achieve it does take a lot.
A lot of these things, I'm going to tell people this all the time. A lot of these things are preventable, guys. I am not saying this just because first of all, you guys, I don't get insurance money. I have a salary. If I work 20 hours, I'm not wanting no money. A lot of these things are preventable. In order for you to get to where you lose your foot, in order for you to get where you lose a kidney, you lose your eyes, it's preventable by regular follow-up, listening to your doctor, eating properly. Because all these things happen when your A1C gets so sky high that the sugar just start eating away everything. It doesn't happen overnight. It does not. It's just like, it's the same thing with your weight. It doesn't creep up on you. You know what I mean? It happens. Your waist start getting bigger, your belly start getting a little bit bigger, your face start getting chubbier. You start seeing these things, these pictures. If you don't ignore them, then you realize, man, I need to go there. When you have diabetes, the first thing you start noticing, Kranky, is you start drinking a lot of water. You start being thirsty a lot. And you start peeing a lot. You start, those are two of the first signs that you see when you get diabetes.
All right. All right, Doc. Well, I appreciate your time. Thanks for being here. Very informative. And we probably do another session. We'll think about if there's other things here that you can help us educate us on going forward. So,
all right.
I appreciate your time, Doc. I know you've been busy, but I appreciate you.
All right. Bye. See you guys.
Right, thanks,
everybody.
All right, everyone. Well, that's the end of the show. First of all, thanks each of you who have been here. Before you leave, hit the like button. Our community is, when shows like these come up, many people don't want to be educated about these subjects, or they're just not as interesting as, say, talk about sports. But I do believe that these things are important for us to come to these forums, talk about them, listen, learn, educate ourselves, because your health is your most important asset. It truly is. And if you're not healthy, then it affects you in a lot of different ways, financially, mentally, affect your family. So you should always try to ensure that you're optimizing your ability to maximize your health, which can help you in so many different respects. And we want to make sure, especially in our community, where things like hypertension / high blood pressure and diabetes are prominent and causes family disruption, causes death, frankly, that we understand how they occur, the risk involved, how we can prevent them, or how we make sure that if they do occur, how we can mitigate them. So appreciate you being here. Thanks for being here, and hope you have a wonderful evening. Peace out. Kranky Life is the best to be now. For the best sports talk, and it's free, yo. Kranky Life will be your guiding light by keeping you informed both day and night. Kranky Life, kill them. Kranky Life, heed them. Kranky Life, want them. Kranky live. From the course to the field, we'll never lose because Kranky has the hottest news. With expert analysis, we break it down. Our in-depth coverage is best in town. Kranky live. Kill them. Kranky live. Heed them. Kranky live. Want them. Kranky live. Kranky live where the sports is spicy and where we keep the discussion lively. Kranky live. Get to know the name because Kranky analysis is never lame. Kranky live. Give me my Kranky live. I want my Kranky live. Must have my Kranky live. Whether it's football or track and field, you know Kranky is at the wheel. So join the journey through victory and defeat and subscribe and don't miss a beat of Kranky live. Kill them. Kranky live. Heed them. Kranky live. Want them. Kranky live. If you're from England or USA, from Kingston or Bombay, from Kenya or Canada, Lagos or Havana, visit Kranky live. Tune into Kranky live. Like up Kranky live. Subscribe to Kranky live. Kranky live. Coming to you on weekdays. Kranky live sometimes on Sundays. Pull up a chair and take a seat because Kranky will always bring the heat. Kranky live. Me say fi tell them Kranky live. Me say fi heed them Kranky live. On them Kranky live. Kranky live will be around. Kranky live is the best in town. Me say fi heed them. Me say fi want them. Me say fi heed them. Want them, heed them, want them. Kranky live. Kranky live. Heed them, want them, heed them, want them. Kranky live. Kranky live. Heed them, want them, heed them, want them, heed them, want them. Kranky live. Kranky live. Kranky. Heed them, want them, heed them, want them. Heed, want, heed them.